All right, Mike Young.
I'm here.
Fantastic. This is actually working. As usual, you have, we've had some audio issues again and whatever. I don't know. It's going great. Hey, thanks so much for being on.
Hey, I always enjoy it.
Do you really, though?
I really do. As long as you don't put me on the spot too bad.
I won't. Hey, it's February 1st, so I want to go over some of these things. Since it's February 1st, there's like a whole bunch of like national days today. So
Okay.
did you know that today is National Freedom Day?
Yes, I did know that.
Oh, really? It's to savor and enjoy the freedom which comes with being
Yep.
an American citizen. Hey, that's fantastic. National Freedom Day. There's also National Baked Alaska Day, whatever that is.
Oh, you don't know what a baked Alaska is?
No, that's not a thing.
It's a dessert founded out at I believe, a deli or something in New York, where it's like ice cream wrapped in cake and a meringue and thrown in the oven for a short period of time.
Ugh. All right. Well, it's also
Um,
National Dark Chocolate Day. It's
did not know that.
National Get Up Day. As it says, we all fall. It's how we get up that matters. Actually, words matter, but whatever.
Yes,
Robinson Crusoe Day. Not sure who that is.
did not know that.
Yeah.
Robinson Crusoe. Oh, you need to get in your literature.
Crusoe. Isn't he a character on the Pink Panther with Peter Sellers?
No, no, he's not.
It's
He was
decorating with.
stranded on a desert island, I believe.
Wow, that's not the right person then. It's decorating with Candy Day. Get
Yep.
together with your loved ones and adorn your homes with candies and sweets.
Who
Adorn your homes.
decorates?
Does that mean like you put them on your house?
Yeah, who decorates with
Who
candy?
knows? And here's the
Eat
last
the
one
candy.
is Spunky Old Broads Day, which seems wrong to say that,
I'm not
but it says unleash your inner sparkle, light up your world with the most insanely awesome tips. Dr. Carson creatively used words such as spunky, old, and broad with negative connotations to create something positive. So there
not
you
going
go.
to touch that one. Not
Yeah, I
going to
wouldn't
touch
either. Good idea. Good morning, everybody. It's Positive Tuesday today, February 1st. Also, Spunky Old Broads Day, 2022. For Spooner Health CEO Mike Schafer, who's filling in for Barron County Sheriff Chris Fitzgerald, I'm Ben Dryden, and you're watching Positive Tuesday with Ben and Fitzy, presented by Professional Exteriors and Interiors. With nearly 20 years of experience, this locally owned and operated business has provided quality work in roofing, garages, siding, window installations, kitchen and bathroom remodeling, vinyl and hardwood flooring. You can even build your house or business from the ground up, which Fitzy last week said they built like an A&W somewhere down there. It's awesome. Like Fitzy and I, Professional Exteriors and Interiors believes that it's the little things that make a big difference. So give them a call today at 715-520-2271. Special thank you to our guest last week, Northwest Wisconsin's very own Chris Crusoe. In case you missed that show or any of our shows, you can watch those on our YouTube channel. Just go to youtube.com/DrydenWire. As I mentioned, Fitzy's off today, so friend and frequent guest of our show, Spooner Health CEO Mike Schafer, is gracing us with his presence this morning. Mike, good morning, man. How are you?
I'm great. Happy to be here. Thanks for having me. You did mention I'm sitting in for Fitzy. Let's just know I'm trying to keep his seat warm. I couldn't do near the job of propping him up propping you up, Ben, that Fitzy does.
Oh, man, that's how we're starting the show already. I
I'm
love
sorry.
it. Yeah, it looks like, you do have a lot more hair.
Got to get my shots in early because I think your shots are coming.
What? No. No. I'm just glad that. Well, actually, it'll be interesting to see how this goes because usually you come on with Fitzy and then you say things and then he just laughs. So he basically encourages you to say those things. So now not having your buddy on. Oh, and good morning to my niece Tia. Aw. Good
Nice.
morning, Sharon. Yeah, Kirk Anderson says you got some big shoes to fill.
Not trying to fill him. Taking up space.
All right, so we always like to start with something positive. I mean, I want to get into some sports stuff or some like Aaron Rodgers thing. We'll get to that at the end of the show. Tom Brady, the Super Bowl, and obviously we're going to be talking a lot about COVID. That's kind of your area of expertise as the CEO of the Spooner Health, some election stuff and politics. But first, we'd like to start with positive things that are going on in our lives. So give me something positive that's going on in your life.
I think the most positive thing in my life is my mother, Shirley Schafer, living in Jamestown, North Dakota, turned 88 yesterday.
Oh, happy birthday.
They had a nice little party with cake for her at her assisted living facility. Unfortunately, the grandkids that live in the town, because of COVID protocols, couldn't go. And Ended up a couple of them are sick with COVID anyway, so they wouldn't have been able to see her. But yeah, 88 years old yesterday.
Aw.
Mom, in case you do watch this, because I know she clicks on things on Facebook when she sees me, happy belated birthday. Had a nice discussion with her last night. So.
Aw, that's nice. So you said, what Dakota was it?
Jamestown, North Dakota.
North Dakota. You go out there every once in a while, and I guess I never realized that's probably why.
Yeah, I hadn't been there for a while. I don't get there near enough to see my mom, but basically once COVID hit, that pretty much stopped trips there. But once she was vaccinated and I was vaccinated, we felt comfortable getting together again. So ended up making about 5 trips over the course of 6 months, looking at assisted living and getting her settled. She made the decision to do that herself. She's very happy where she's at. So yeah, it's been a really good. COVID hit her hard. It hit as it did a lot of people. The isolation and that was very difficult.
Yeah.
So. But she's in a really good place for 88 years old, and with some health issues, she's doing well. So.
Outstanding.
Yes.
Well, mine is nothing even close to yours, because that's a great story. The positive thing, I guess, because not really a whole lot has been going on, but I got to tell you, man, and we'll get to some sports at the end of the show, but NFL playoffs this year has just been fantastic. I mean, it has been so good. And I picked the Bengals to win, and I picked the 49ers to win, and the 49ers almost did, but it has been just a great NFL playoffs.
I would agree. To me, the last 2 weekends were the best weekends of playoff football I can remember in a long time. And for people like you and I, Ben, who root for teams that often aren't playing this time of year, it's really fun just to sit back and see great football games.
Yeah,
and that's what we've got to see.
I also had another positive thing.
Okay.
I got to see you yesterday.
Oh, yes.
Yeah, that's right. Yeah, I went to, so this weekend, because you're filling in for Fitzy, which I don't know where he is. I think he told us. I think he probably...
He's speaking to some sheriff's association or something.
Okay.
He said that last week.
Did he? I can't remember. I
Thought
thought it was...
on your show if you pay attention.
No, I don't. I ask questions, but then I don't listen. I thought it was like they were over budget this year. The sheriff's department was. So they were over budget. So then it's that time of year. Then they take the money that they were over, and then they go to the casino and try to gamble and make more money. And you can quote me on that.
Okay.
But I'll have to double check. But no, because you're filling in.
They balance budget by going to the casino.
Yeah.
Huh?
So I went to the store this week and I got you a gift.
Yes,
Because you're graciously coming on, filling in for Fitzy. So I went to the store, got a gift, had my wife wrap it because I don't know how to wrap presents. I mean, I'm sure I can figure it out. But she wrapped it, and I went to the Spooner Health yesterday and I dropped it off. But with a caveat as you can't open it until the show. So do you have that gift?
I have that gift.
All right, go ahead and open it.
It was very tempting to open it before because you're setting me up for something, and I know that.
No,
so.
It's a gift. I like giving to others. It's Positive Tuesday. Put it right in front of the camera so we can all see it. See? Just for men.
You don't like my gray hair?
No, I'm just giving you an option. That's all.
Hey, when I was 28 years old and a hospital CEO, having a little bit of gray didn't hurt me back then.
Yeah, like you and Leslie Nielsen were born with white hair.
Well, my dad died at age 72 with a completely full head of thick hair. Ben, I appreciate the gift.
You bet.
Had I known it was gift giving, I'm sure I could have found some Rogaine somewhere. So,
all right, moving on. So, obviously, I want to talk about the COVID. I mean, not specifically, but everything under the umbrella of COVID. So, I think we're almost at 2 years now since this kind of, at least in our area or in the United States, this has been going on, right? Wasn't it about this time 2 years ago?
It was about March of 2020 where they ended up shutting down schools and everything shut down, yeah.
So it was about 2 years ago. So if you could, from a Spooner Health CEO, because you've been the Spooner Health CEO for how many years? 30-some years, right?
31 plus.
31 years. You've seen a lot of things. You obviously have been a part of this. You have Zoom meetings, you have calls, you have emails, this is your world. Like Fitzy with the sheriff, he knows things with law enforcement and things going on in the county related to that. You would be, and just to be clear, you're not a medical expert, and we're not giving any medical advice here.
Correct.
But just in terms of over the last 2 years, where are we right now with COVID?
Well, where are we? A lot of it seems like the movie Groundhog's Day is one of the best comparisons
Sure.
I've heard. And it's been just a roller coaster ride. Um, I don't know where to start.
Well, how about this? Where are we
Through it
right
yet.
now in our area? Because you look at obviously Washburn County, but you also pay attention to other area counties, Northwest Wisconsin and the United States. Well, let's not really get into the United States. Wisconsin, or if you can, Northwest Wisconsin, our area.
Okay.
Where are we today? Because I know it's gone up, right, in terms of new cases with Omicron after the Delta variant. Where are we right now? Are we seeing that continuing to rise? Are we steadying off in terms of new cases? How about deaths? What are you seeing?
Let me back up to about December. December of this year, well, when I watch the statewide data, we are more like Minnesota than Wisconsin when it comes to when we get hit, when our trends start. In December of this year, early December, Northwest Wisconsin, we were experiencing our Delta surge, the Delta variant, very, very deadly, very severe. We were seeing that much later than the eastern and southern parts of the state. So we saw our peak hospitalizations during that time happen around the beginning of December, saw a nice little drop starting in the trajectory of cases, and then Omicron hit. Omicron is much more contagious. I've read a lot of studies say up to 7 times more contagious. And admittedly, it's not quite as severe to most people. Great Britain studies showed that you'd have about 50% less hospitalizations with it. But as I was talking with my daughter about this, she goes, well, 7 times the cases times 50% less hospitalizations, you still have the potential to see a lot more people in your hospital.
Right.
And that has happened. We barely got a breath in Northwest Wisconsin after Delta before Omicron hit. And we've been hit hard with it again. The number of cases, record cases in our county and in Northwest Wisconsin, looks like the number of cases may have peaked here. It's right kind of at that precipitous. The eastern part of the state and southern part of the state peaked about a week and a half or 2 weeks ago, and the numbers have just dropped dramatically.
Okay.
Wisconsin was averaging 18,000 cases a day, new cases a day. Numbers down to about 6,000 a day in just about a 2 weeks time. So we are seeing what other parts of the country have seen with it. Hits hard and drops quickly. We are maybe seeing our peak in this part of the state. Minnesota, the Mayo model that they use was projecting the peak the end of last week. But the one thing that always worries us is hospitalizations is a lagging statistic. It lags about 10 to 14 days.
Why?
Because people get COVID, they get progressively worse to the point where they need hospitalization.
Okay.
So they don't need hospitalization day 1 or day 3 or day 4. If they have a hard time, their body has a hard time processing with COVID and that, it happens later. So we have still seen a high number of hospitalizations here in Spooner and in Northwest Wisconsin. I thought I might have wrote down the numbers.
I thought maybe.
For Northwest Wisconsin. We're not at the highest we've been with this peak, but we're still up there at numbers. So we've not seen the precipitous drop that other parts of the state have seen. I was reading something from the CEO of Wausau the end of last week. Aspirus is a big system out of Wausau, and he had said, we're not experiencing in the north central part of the state what the southern and eastern part of the states are. We're as busy as ever with COVID. So, but it does appear that we've hit the peak with Omicron. Hopefully that stays that way. Now they're talking another variant. Who knows? But it's been a tough run for.
So, if I can, at what point? What was the? I don't know how to say this other than what was the worst situation or time at Spooner Health or what you had seen in other hospitals in our area in terms of, I hear things about ICU units. And if we have more people that have, actually, I'll let you explain that, but my understanding is that people that have to go in and use an ICU unit, that then kind of takes away from, people who have other needs that are not COVID related, but need ICU units or beds or whatever that stuff's called. So was Spooner Health ever at a point, or Northwest Wisconsin, that you were aware of at a point that, yeah, we have to turn people away, or did that never get to that point? And if so, when was that?
It got to that point. The worst, I would say, for us was December and January of the whole pandemic. The worst times.
Just this recent, last 2 months.
Recent, yes. What's happened is you can't find, Spooner Health does not have an ICU. Shell Lake, Hayward, a lot of the small hospitals don't have ICUs.
Oh, I didn't know that.
I believe there's an ICU at Marshfield and Rice Lake. But what has happened is we see all this influx of COVID patients we were seeing. We also were seeing a number of patients for other things. Many patients dealing with chronic conditions that they didn't get treated early on in the pandemic. So by not getting treated at that point, they got worse. First hospital shut down services because we didn't know what we were dealing with in March and April. And then people, I think I said on your show, hospitals were the safest place to come. Yeah. But people were scared to go to hospitals thinking they were going to get COVID. So what had happened is we have a patient come into our emergency room with something quite serious. We could not find a bed at another hospital. We would call statewide. We would call Minnesota, sometimes 50 calls trying to place a patient at a higher level of care than was needed in Spooner. And, the misinformation that's out there in the way people talk, they talk about, well, COVID isn't causing this. Well, COVID definitely shoved it over the edge. There were a lot of other things, but the COVID patients made it difficult. We would consistently have 4 COVID patients every day. They're a very high level of care. Staff going in and out has to don and doff their PPE, so put on all the precautions every time in and out. But we were dealing with capacity that we can handle in our hospital, and then having those patients that need a higher level of care than we typically provide. And it's not just us, this was everybody. Mm-hmm. So a higher level of care than we typically provide, we could not find placement for them. We had patients, we called them boarders, in our emergency department for a couple days, where typically they're gone in just a few hours if they need a bed. We sent, I believe one person got sent to Madison to a hospital. We found a bed finally. Our typical referrals are Duluth or Eau Claire, and occasionally in the Twin Cities. So hospitals in Northwest Wisconsin, in all of Wisconsin, Minnesota, we've just been slammed. Last thing I've seen in Minnesota, they still have less than 2% of their beds vacant and less than 1% of ICU beds available. We've started to see a little bit of a loosening up in the western part of Wisconsin with ICU beds just recently because it gets reported on daily. So, it really has stressed hospitals. Then we deal with staffing issues as well. I had heard somewhere that 30% more nurses retired in the state of Wisconsin last year than the year before.
Was that directly related to COVID? Is there any data to support that? Or was, because I've heard this before about the people in that field where it's a lot of baby boomers, I believe. Now, this could be very old. It could have been 5-10 years ago I heard this. So 30% more than expected? What's that 30% more of?
My understanding, 30% more than the year before. We expect higher retirement rates because people call it the gray tsunami. It's the baby boomers getting out. But people are just tired. Nurses are tired. They're taking care of patients that they're watching. We have seen more death in our hospital than typical. It's tough on staff when they have to deal with that. And COVID is not a pleasant way to die. Now, that may sound terrible to say it that way, but it's basically you can't breathe. And it gets worse and it gets worse. And it puts a lot of stress on nursing staff, respiratory therapists, all those providing care. It's been difficult on them. So, I think that's part of what we've seen with the retirements and that. And what you hear is it's just like, wow, I just can't do this anymore. Yeah. Out
of curiosity, and maybe you don't know this, but when you have to send someone to Madison, right, who pays for that? Is that their insurance? Is it the hospital? Who pays for that?
Insurance, Medicare, patient. Depending on what they have for insurance.
And so when you say send, you just say go there, and they have to get themselves there, right?
No. We always arrange a transport, whether it's a ground ambulance, whether it's an air ambulance. Occasionally, we've seen people transfer by private car, but typically when you need a higher level of care, private car is not the appropriate way to transfer.
Probably not. And I agree with. Do you agree with Connie? There's a statement up there.
Yes, I agree with Connie. Our nurses are heroes, but I would take that a lot further. All of our healthcare workers are heroes.
including CEOs.
I wouldn't go quite that far with it.
Hey, so I do actually have a question for you, probably a medical thing. So I've gotten I waited forever and I got my shots. I
Yep.
don't know, November last. Anyway, it's been a couple months. When am I supposed to? When am I supposed to get that booster?
I believe what the guidance now is 5 months after your
5 months.
second shot, if I'm not mistaken. And congratulations for getting it. I will say again, what we are seeing in our hospital, even with the Omicron variant, even with that, it is the unvaccinated that we are seeing mostly in the hospital. Vaccination to me is still the way to go. I mean, there's a lot of misinformation out there on vaccines, but what vaccines, Omicron proved that being vaccinated and boosted may not keep you from getting COVID.
Sure.
But those that did, it was typically very mild.
Yeah.
You
Honestly,
weren't
that's why
sick.
I did it. No
Yep.
kidding. I mean, I'm 45. I'm not the pinnacle of health. I will die from something. I don't think it's going to be from a vaccine.
Yep.
I did it because if I got it, I just didn't want to be sitting in a hospital for 2 or 3 weeks or an
Yeah.
ICU. I just didn't want to do that. And what am I going to do with my business? And then, we have responsibilities. That was literally it. It wasn't that I was worried about getting COVID, but I just assume, I really do. I just assume I'm going to get it at some point. And maybe that's a bad way to think. I just kind of assume I'm going to. I still take my precautions and I wear a mask when I go in public or if I'm around a whole bunch of people, which I'm really not. I'm pretty much an introvert. So I prefer just kind of staying at home. I just didn't want to be laid up for a couple of weeks and have horrible pain and maybe even die. But that was really it for me. So you had talked about misinformation. Where does that misinformation come from? And don't say Facebook, unless that really is a thing. How about more from a media standpoint? Is the
Well,
media, in your opinion, doing a good job of covering? So when you watch it, because you watch it through a different lens, when you see the nightly news or you read things from CBS, NBC, ABC, whatever, you see it through a different lens. Are they
yes.
doing it the right way? Or is there
No.
something that you wish, yeah, you're actually hurting, not helping right now? And if so, what is that?
Well, from the beginning, COVID has been politicized.
What?
Both,
No.
yeah, both political parties. And I'm a little skeptic when it comes to news. I'm a news hound.
Me
I
too.
love the news, but to me, the 24-hour news cycle is one of the worst things that's happened to this country because they're always looking for something to print. And I don't care if you watch NBC, ABC, CNN, Fox News, Newsmax, any of those, especially if you watch the evening shows, they're not news shows. They're opinion shows. And they
Yeah.
are catering their message to an audience. And I flip the channels a lot and I watch and I get angry at them all. So that tells me that either I'm wrong all the time or they're all not doing a great job because they tell the side of the story they want their listeners to hear. And they'll omit other important parts. And it's just sad. It's sad that it's all, and I mentioned 24-hour news cycle. It's all about demographics. It's all about ratings.
Hmm.
And give me Walter Cronkite at 5:30
Right.
p.m. where you get him for half an hour, in the newspapers and that.
Yeah.
Now there are places that you can go. I prefer to read my news, on the internet or whatever.
Thank you, Al Gore.
Yeah. Oh God. Yeah. Yeah. Didn't he invent the vaccine too? No, I'm just kidding.
Probably. I mean, at this point, why not?
Yeah, but no. So I mean, that's what's most frustrating to me is I think the news has done a terrible job.
What would you
And
want them to do? What would you want the news to do? You say they're fitting sounds like kind of like a narrative, right?
yeah, I think
Um,
you
and yeah,
lay
we've
the
all known that
numbers.
about news. That it's just it's money. Duh.
Yeah.
It's not it's kind of like politics. Don't hate the players, hate the game, right? Of course we know why they're doing that, but what would you like to see when you watch news or read news
both
regarding
sides
COVID?
both sides of a story and let the people decide.
Love it.
Give facts on both sides and let the people decide what's right. I
Yeah.
mean, I can't remember what the point was the other night. TV was on in our house, and I just said, yeah, that's what he's saying isn't false. However, what he's neglecting to say is boom, boom, boom. That goes with it, telling half or 2/3 of the story. So
Yeah. So what do we? What does summer? Hold on a second. Before that, Romaine Quinn has a question, I think. Setting vaccination aside, what, if anything? Okay, I don't even know what you're talking about. That's not even a question. All right, try that again, Romaine. So what does summer look like? We're in February 1st right now. You had mentioned there's another variant or potential or something. What can you tell us about that? And what does just the summer look like for us?
First off, it sounds like an offshoot of the Delta variant, just kind of another mutation of it. So, Ben, I wish I had a crystal ball.
Me too.
Last summer was pretty good. Remember,
It was actually, yeah.
I remember we were having meetings here with vaccinated people without masks on.
Yeah.
CDC guidelines had changed. We follow CDC guidelines very closely at the hospital.
You, Fitzy, and I, we were down at the Shellick with my brother Matt. Fireworks.
Yeah.
Right. I mean, yeah, it felt like we're kind of getting past this.
And then the Delta variant came along. So I'm optimistic that we're going to see a lull again. I'm hopeful, I guess, would be better than optimistic. Delta really hit when we went back inside, late fall, early winter, other than people being outside and doing things outside. So, I think we're looking at COVID being a way of life. It's not.
Is it the new flu?
No, it's a new flu. It's been more deadly than the flu so far. But what will happen with the further mutations? We're going to have to learn how to live with it, to live with it safely. I try to read as much as I can get my hands on it. Again, I'm not a doctor. I'm not a scientist. But, there's a lot of people who believe future mutations may be very contagious, but still getting a little less severe for people.
Sure.
I hope that's the case.
Sure.
But I do think that, this is something from what I'm reading that we're probably just going to have to learn to live with and go on with our lives, figure out the best way.
You got it. All right. Well, there's Romaine. Setting vaccination aside, what, if anything, can the state do to help hospital systems handle the current influx of patients? Great question, Romaine.
It is a very good question, and it was a question really needed a couple months ago. Things are doing a little better, but a couple things. One of the other things I didn't mention that has happened is hospitals end up with a lot of patients in their hospital that do not need to be hospitalized, but there is no level of care, lower level of care, nursing home beds, skilled nursing facilities available because of bed supply, staffing there. There was at one point, there were over 400 patients taking up hospital beds in Wisconsin that the patients did not need to be in a hospital. They didn't need that level of care, but they couldn't safely be discharged to home. So they stayed in a bed. One thing that we really tried to get the state to look at was how do you open up more nursing home beds? How do you do things? And in the last month or so, there were a couple of things happening with the state, and they were bringing National Guard into hospitals to help staff as well. But that would have been a huge thing a couple months ago. Is you can think when every bed in the state or most of the beds are basically full, having 400 of those being patients who need a lower level of care, being able to move them somewhere and having a place to go would have been very helpful.
Yeah. And actually, I do want to get into, I have a question that kind of tied to Romaine. But before that, Dave Armstrong, my biggest issue, the start of the pandemic, is the sole focus on vaccine and little to no focus on developing effective treatments. Go home and take a NyQuil, ? That's it. What are your thoughts on that?
I don't completely agree with Mr. Armstrong on this one. There have been a lot of people working on treatments. I mean, you look at monoclonal antibody therapies, which were brought up, and the ones that were out there worked very well with the Delta variant, had good effect. Just like, I mean, the push early on was to find a vaccine, which I think had to be done. I think that was the right thing to do. Operation Warp Speed really cut down red tape to make that happen. But I think you do see people out there trying to develop these therapies. Pfizer now has an antiviral pill, it sounds like, that works very well.
What?
It's a pill, but it's in very short supply from what I hear, because you have to ramp up production and things like that.
Sure.
So, I think you hear a lot about vaccines because they're available and they're proven to be safe and effective and against hospitalizations and death. I mean, to really drop those things down. But there aren't a lot of the other treatments out there, but I believe everything I read, they're being worked on all the time.
Yeah, I mean, from your knowledge or understanding, what you've read or what you've heard or part of the meetings that you're, that you're in. This is still a relatively new thing, right? I mean, it's been 2 years. I know that there has been some questions or concerns that we're not moving fast enough, and there was a reason for it, right? This is like the conspiracy theorist people, which that's fine if that's what you want to believe. But this is still pretty early, even though it seems like right now it's been freaking forever. But
Well,
it's really still early in this, so it's going to take a while.
Yeah. I mean, COVID was first recognized, I believe, it might have been December of 19 over in Europe or somewhere. So, yeah, we've been dealing with this less than 2 years.
Yeah.
The science of getting that vaccine. Now, the mRNA technology, everyone wants to talk about a new technology. mRNA technology was actually developed, I believe, in the early 2000s. They were looking at MERS and SARS, never needed it. But the technology isn't brand new. So the technology sat there. Then, okay, how do we find a vaccine that works against COVID?
Sure.
I mean, it's remarkable how quickly a vaccine came out.
Yeah.
And it's remarkable on how I read your questions. And
I'm sorry. I probably shouldn't put those up right in the middle of your talk.
It's remarkable how quickly it came out.
Sure.
The other therapies need to be there. Yes, Dave, you're right. Some of the antibodies have been pulled back by the government because they've been proven not to work. The monoclonal antibodies that worked for the Delta variant have been tested against Omicron, and they don't do any good.
Oh.
We had received word from the state when we were first hearing about Omicron that when the state reaches a certain saturation of Omicron cases versus Delta, they'll be pulling it because it doesn't work against Omicron, and then going to the new antibody treatments they have, which are difficult to get.
Sure.
But, I mean, the science shows, and I believe what I've been reading from independent places, that the antibody treatments we were using for Delta are not effective on Omicron. And that's why the government says, I mean, is it really much better than giving a placebo at that point if they're not effective?
Yeah. Speaking of government,
Yes.
and bringing in politics, because that's just always a very neutral, safe place to go, is politics. President Trump, 2020, when COVID, a couple years ago, he was a president. And how did he, I don't want to ask how did he do, but then we had, so 2021, right? So presidents are like head coaches sometimes in sports where they get a little too much credit and a little too much blame kind of at the same time. And that's fine. It is what it is. But a lot of people didn't think that Trump did a great job. And some people maybe thought that he did. And then Biden comes in and says, no, I'll get under control. And for a while there, it seemed to be going well. And now it's not going very well. And polls are showing, oh, we don't like how you're handling, whatever. Does the president, in your opinion, from the Spooner Health standpoint, from your profession standpoint, from a COVID standpoint, does it really matter? Another way to ask that would be if Donald Trump got elected and he was still our president, would we have Delta? Would we have Omicron? Would we basically be where we still are?
Yes.
Well, love it.
No,
all right.
I will just say, what role does a president play? The president plays a pretty important role because they're appointing some of the positions that are responsible. And we can analyze and slice and dice the past two presidents. I mean, Trump's major feat in this was he knocked out a lot of red tape to get a vaccine. Mm. I mean, no one thought Operation Warp Speed would work, as quickly as it did. They got a vaccine. On the other hand, Trump also put a lot of doubt out there in people's minds about COVID, about how severe it is, et cetera. At the time Operation Warp Speed was going, our current president, Joe Biden, and current vice president sat in, I believe it was in the debates, and said they'd be hesitant to take a vaccine developed that quickly under President Trump's watch. I share that because we talked about how politicized it is. Both sides of the aisle have done huge damage to credibility and to getting people thinking about COVID. They put out the sound bites that people like to fit to their narrative. I mean, my statement now, people's idea of research is going on Google and finding something that supports their opinion.
Yeah, I think that kind of ties back into what you had said earlier about how media has played their role, because if politicians are talking about it, then the media is going to report on it. Therefore, that's all good and great for a media show or for sound bites. But what we're missing the real narrative here.
Yeah. And Biden promised in the campaign trail that he was going to lick COVID.
Yeah.
Well, let's be honest. Presidential candidates from both parties make a lot of promises when they're doing their campaign that never
Yeah.
come true. And if Trump were president, would we still be dealing with these things? Yes, we would.
Yeah.
Would we be dealing with them differently? Yeah, probably. And I'm not going to make a judgment on who would do a better job. I think it's a pandemic. It's a very bad virus that has went around the world how many times with different variants, and it's not so easy for anyone to say we're just going to lick this.
Yeah. Well, I'm going to throw up two more things here. Then I want to get on to a couple of political questions and some sports talk. But Dave Armstrong, have we lost any hospital beds since the start of the pandemic? It was reported last week that 3 million were lost nationwide.
I don't know about the 3 million number, but yeah, we've definitely lost beds. They're not in Wisconsin, but there's been hospital closures throughout the nation. Hospitals have limited the number of beds they have open because of staffing issues. And some people liken it to the vaccine mandates in Wisconsin. Around 1%, less than 2% of people left healthcare employment, hospital employment because of vaccine mandates. So to me, it's not the vaccine mandate that was the thing that drove people out. A lot of reasons people left healthcare, but we've lost. When we talk about bed availability, the key term is staffed beds. Because you take some of the larger hospitals, they have beds, they don't have the staff to fill them or to care for the patients.
Got it. Karen Baker has a question. Has there been a lot of children getting COVID in Washburn County?
I don't see much on that. I know there have been anecdotally that have been getting it.
What's anecdotally mean?
It means I hear about it. I don't
sure.
see it through work here. I don't see the stats on the age of people who get COVID in our county, but you hear about the schools and people being hit hard. I do want to comment. You threw a comment up there when I was talking earlier, Ben, about nursing home beds. The guy had put up there that the plan to put people in nursing home beds didn't work so well.
New York, I think is what it was.
Yeah, in New York. I want to clarify that, though. That was early in the pandemic when they were putting COVID patients into nursing homes. When I was talking about nursing home bed availability, I'm talking patients who are non-COVID that don't need hospital beds. They need like a skilled nursing bed or a nursing home bed.
Yeah.
And so it's completely different. And if I didn't explain that right in the first place, it's not trying to put our COVID patients into nursing home beds. It's non-COVID patients who don't need that high level of care.
Got it. And I'm glad you clarified that, because actually that's what I thought.
Yeah.
What you were saying. So here's another. How has the pandemic and mandates affected your hospital staffing?
Had little effect on us. We had very high vaccination rates early on. I think we did a good job of educating our staff. Our lead pharmacist, Tim Bassett, did an excellent job. You know Tim, yeah. Excellent job in educating staff as to the efficacy and the safety of the vaccine. We had a few people apply for exemptions that were granted exemptions for good reasons. But we had no real issues with the mandates because we were so highly vaccinated to start with.
Awesome. Clint Moses has a question. What are your thoughts on the job Dr. Fauci has done? Boy, that guy, he takes, oh man, sometimes, we get comments or emails that are negative, and Fitzy and I talk about that, and some don't hit, but boy, I wouldn't want that guy's job.
I'll pass.
Pass.
Yeah, he's in an impossible position, and
yeah. Yeah, no kidding. Hey, so speaking of, we've had Romaine Quinn and Dave Armstrong on, or commenting on here as well. So I want to ask you, with an election cycle coming up here, or we're kind of currently in an election cycle.
Yes.
Romaine, of course, is running for the 25th Senate District against Janet Bewley. I think Spooner Hospital, as of right now, we don't know where the map's going to fall, but I believe Spooner Hospital falls under the 73rd Assembly District, which would be Nick Milroy. I don't know if he's running again. He hasn't announced, or anyone else is there. Or if it changes, and who knows, maybe Dave Armstrong will be your representative. The reason I'm bringing these names up in these areas is to ask you, does it make a difference if Romaine Quinn or Janet Bewley, from a Spooner Health Hospital, from the COVID, everything that we're talking about, does it make a difference having your area representative or your senator? Does it make a difference which one that is?
It does, but not in the way of thinking of a lot of people from political party necessarily.
Okay.
It's more someone who really takes an interest in healthcare, in the fact that the hospitals are some of the largest employers in most of these communities,
True.
and someone who will take the time to really sit down, listen, and understand what's going on. I can say I have had excellent relationships with Romaine Quinn. I'm not in Romaine's district, but Romaine was someone that I felt I could talk to about healthcare issues. I've had excellent relationship with Janet Bewley, who's our senator. And both of them took a real interest in healthcare in their roles. You run into some other representatives who healthcare may not be their thing.
Sure.
And I, of course, want that person who's going to support rural hospitals and be real in tune to rural hospitals. But a lot of COVID stuff happens at the state level. So it's very important that those representatives are in tune to what's going on, educated to COVID. I love the fact that Dave Armstrong, I've communicated with Dave many times. I've never face-to-face met him because of the pandemic and everything. But I like the fact that he's asking those questions. Romaine the same way. We want educated legislators, who are willing to listen and hear what we have to say. And I recognize that they're not always going to agree with everything we have to say, because they have a whole gamut to look at when they're doing things.
Sure.
But it's very important for us to have people, and we've been fortunate in this area to have some people like that. Even dating back a few years, Romaine's predecessor, Mary Hubler, who I was actually in her district for a while before things went, she was very engaged with what goes on in rural hospitals. So for these rural legislators to take an interest in their local hospitals and healthcare is so important to not just the healthcare, but to the community as well.
So there's also a sheriff's election coming up. And now you've been the CEO at Spooner Health for 31 plus years. Dad was a sheriff for 28, and he's been retired for 3 years. So pretty much for almost the entire time, those first 28 years you were the Spooner Health CEO, my dad was the sheriff in Washburn County for 28 years. I don't know what that relationship looks like. Not Mike to Terry Dryden, but from Spooner Health CEO to sheriff. I know that you and Dad knew each other, and I'm sure you had conversations. Actually, let's start there. What was that like? What is your relationship with the sheriff? Talk about Dad specifically.
Well, I had a great relationship with your dad over the years because it built over time. Sure. When I first got here, I was kind of the young whippersnapper. He was the new sheriff. Sure. Your dad and I didn't always agree on things, but we had
Dad and I don't always agree on things. Usually when it came to my bedtime and my allowance.
And your dad was probably right most of the time.
He's usually right.
No, but I had a great relationship. I could pick up the phone, talk with your dad. I mean, I can think of some things that we had to install. We are governed by a set of laws, HIPAA, things like this, that law enforcement isn't. So we had to change, sometimes ask your dad to say, your officers need to do something a little different when they're here. We see law enforcement when it comes to emergency detentions, things in our emergency room, overdoses, patients, whatever. So law enforcement provides a great support to the rural hospital and to hospitals, not just rural, hospitals everywhere. So that relationship, I haven't developed that relationship with Sheriff Stewart. He's fairly new, compared to your dad. And like I said, it built over time with your dad. But other people here do have a relationship with law enforcement, have a good relationship locally with Chief Chrisman. So very, very important. That's obviously a hired position versus an elected position. But yeah, I think that relationship with local officials and even county commissioners, you haven't mentioned county commissioners, but same thing there. Because through a pandemic, when you're dealing with public health a lot, our relationship with public health at the hospital is stronger than it's ever been. Weekly meetings for a long time during the pandemic with area providers in public health. So yeah, local elections are important to places like us.
Have you had conversations with Dave Wilson?
Oh, never. I can't know.
All right, just checking. So
it reminds me, I'm supposed to return a phone call to him. Thanks, man.
So with that being said, then, so it sounds like your relationship with a sheriff is not the same, but similar to the relationship you have with the Janet Bewleys, the Romaine Quinns, etc. It's the conversation, keeping those doors open, being at the same meetings, stuff like that, right?
That's what you strive for, yeah.
Sure. So does that? I'm going to ask you an election political question here, and you certainly don't have to answer it. Does that play, you obviously live in Washburn County, into your mind when it comes time to vote for the next sheriff or a whatever district you're in for assembly. Obviously, you're in the 25th Senate district. Does that come into play?
It definitely does. I have my own convictions. I have my own way. I think outside, necessarily of my job.
Right. You
But it
separate those two.
definitely is in my mind some too. If you have a candidate who's been wonderful for supporting, I mean, not just my livelihood, but the people who work here, rural health in general, that definitely plays in if they're of the party I don't normally vote for. So you do think about it.
All right. So first, thank you so much for kind of walking us through a whole bunch of this stuff. I've actually learned. And every time you come on, you learn things. Because I learn things. So thank you for doing that. And so I want to quickly wrap up because we already hit our time at 45 minutes. But I have some sports questions for you. Not trivia, though. I want your opinion. Tom Brady announced that. No, I'm sorry. He hasn't announced. Tom Brady is being reported as being retired. But he says, I haven't made a decision yet. Do you think Tom Brady is retired?
I think so. But I did read also that he can't retire before February 4th.
Yeah, a bonus or something, right?
$10 million hit or something. Not that he and Giselle need the money, but
I know. I'm going to play conspiracy theorist here.
Yep. Okay.
I'm going to say that he is the one that leaked that information to the media because his wife wants him to retire.
Okay.
So he's leaking it to them without her knowing. Then it's getting reported, and now because she's very competitive as well, now he'll start having those conversations with her that, you know what, just to kind of say, screw everybody, I'm going to come back and play another year. I see. I'll tell you.
I've heard people say it was Adam Schechter who initially that this is kind of his "I'll stick it in your eye, Adam," and show you. But
yeah, that's what I think.
An interesting conspiracy theory. The guy's got nothing left to prove.
No.
He's the greatest of all time.
Yeah.
Yes, he has Deflate Gate and some of those things in his background. But on the other hand, what is he, like 46?
44.
And 44, phenomenal shape.
Yeah.
George Blanda played in his 50s, but of course he became just a kicker at the end of his career. But you're too young. I'm sorry.
Yeah. All right, Kirk. Yeah, we'll see if we can get Tom Brady. And if that's a hockey player, I don't know who that is. What about Aaron Rodgers? You were on a show.
George Blanda was a quarterback kicker for the Raiders back in the 60s and 70s, not a hockey player.
You said a quarterback kicker?
Yes, both. And the end of his career, he just kicked.
Okay. So you were on our show last, I think, or not last, but one of the times you were on, I think it was our 50th episode. This is our 80th one. And I think you and Dave Wilson were on, and Fitzy and I. So we're all four of us on. And this was right around the time before football started where Aaron Rodgers talk was up.
Yep.
And is he going to play or not? Fitzy and I both said, no, he's not going to play for the Packers, which of course he ended up playing. And we said he was going to go to the Denver Broncos. Or he said the Broncos, I said 49ers or Raiders or something. But you and Dave had both said he will play for the Packers. And you guys were right.
Yep.
Savor the flavor because it doesn't happen very often. I'm going to give you a compliment. But you were right. But now it's a little bit different. I hear him saying how wonderful the Packers organization is and, oh, everybody's great, which sounds to me like that dude is just trying to preserve his legacy and he's out. He's already made up his mind. Does Aaron Rodgers take another snap for the Packers?
Yes.
Really?
Yes.
Even though they're like $45 million over budget?
Yes.
Or under the cap, I should say, or over the cap?
I can't, and I could be wrong. Nobody saw Brett Favre wearing another jersey, but they were pushing Favre out. I mean, let's be honest. You had Rodgers sitting on the bench. They were going to lose Rodgers. Yeah. I can't see him in another jersey. I rooted Brett Favre on as a Viking quarterback, because I always liked Brett Favre, even though I hated what he did to the Vikings. I'm not a fan of Aaron Rodgers, I'll be honest. Fun fact, Matthew Stafford spent his career for lowly Detroit. He's won as many NFC championship games as Aaron Rodgers won. Think about that.
He's only won. Wait, what? The Packers have
won one NFC championship game. Rodgers has been to one Super Bowl, right?
I thought he'd been to. I think he's won one Super Bowl, but didn't he go a second? Maybe not. I don't know. Actually, I don't. If anybody knows, let us know. I don't know how many Super Bowls has he gone to.
I don't know. But what I do think is funny, and I'm probably going to get myself in trouble for this, is how spoiled Packer fans are.
30 years of Brett Favre and Aaron Rodgers. Like the Bears have had like 40 quarterbacks in the last 2 years.
Yeah, 30 years of Lynn Dickey, Randy Wright, where they were just terrible. And I was talking to my son Tanner. He's in a group chat with these guys who it's Jordan Love's time. It's Jordan Love's time.
No.
Well, Rodgers hasn't won the big game for him, but Rodgers has won the big game once. I'm sorry, but he's brought them great success. And to think that you can go down the road with Jordan Love, I mean, when Favre left, you had Rodgers sitting in the wing. Love is no Rodgers. So,
all right, last question. Who do you got for Super Bowl in a couple of weeks? So I had picked the Bengals and 49ers to go. But it's the Bengals and Rams. Bengals seem to be the hot pick. Like everybody's saying Bengals. I've picked them to win all 3 games that they won. But honestly, I'm not picking them on this one right now, and I could change. I haven't made my official prediction, but I'm going Rams. Who do you got?
I think the Rams will be tough to beat. And there's a part of me. There's a part of me would love to see Matthew Stafford win that game.
Yeah,
after toiling in Detroit for his whole career. But boy, Joe Burrow is exciting. I read somewhere that he could become the first quarterback, and I'm not sure if this is right or not, to win the Heisman, the national championship in college, and the Super Bowl. Mm. But that team is just they're fun to watch. And don't give up. But I'm thinking right now, if I were betting today, I'd probably say Rams.
Yeah, I think so. And it would be nice for Joe Burrow, but it's his second year. He's got plenty of time.
Well, you think that, but rosters turn over, salary cap hits. You may just get one shot.
All right, what do you have coming up this week? Anything going on?
Not much. I think that we host lumberjack hockey players at our house, so they're back in action after the Ontario shutdown for a while this weekend. So my winters, now that my kids are gone for playing hockey, I got the lumberjacks to follow. Other than that, just work and
just work.
A week. Yeah.
When are you retiring?
A while.
Wife doesn't want you at home, huh?
Well,
she won't let you.
She'd probably get a second job if I retired, so she wasn't always like that. I got a daughter still in college, and I love what I do. I mean, that's important.
You are very passionate about it.
Yeah, I can't say I love it as much as I did. The last 2 years have been the toughest of my career. Absolutely no doubt about it with the COVID and everything. But, man, we got a great staff here, great people. I love coming to work. So when I lose the passion for work, I'll retire. But for now, that's not in the near future. I don't think so.
This Saturday is my wife's birthday.
Oh, happy birthday, Jerusha.
You know what? I better double check that. I think it's Saturday.
God.
It's either Friday. So now, you know what? Now I'm thinking it's Friday. Either way, this week is my wife's birthday. So, and I know what women
send the
like.
Flowers ahead of time.
I know what women like. They don't want their husbands to make a big deal about it. Don't worry. So I'll just say happy birthday and leave it at that. Not going to get her anything. Not going to do anything for her because that's what women like. Don't make a big deal.
That's a great plan.
That's
what
I'm
I think
thinking.
You should roll with it.
I know.
Do you have a doghouse to sleep in?
She's building one. Now I think about it. I thought it was a greenhouse, but I'm starting to think maybe not. Thanks, Mike, for coming on.
I enjoyed it. Thanks for having me.
You've been watching Positive Tuesday with Ben and Fitzy, presented by Professional Exteriors and Interiors. Like Fitzy and I, Professional Exteriors and Interiors believes that it's the little things that make a big difference. With nearly 20 years of experience, this locally owned and operated business provides quality work, both the outside of your home or business and the inside of your home or business. For more information, give Brian a call at the number that's on your screen right there. For Spooner House CEO Mike Schafer, filling in for Barron County Sheriff Chris Fitzgerald, I'm Ben Dryden saying thank you for watching and thank you for all of the comments and questions. It was very nice of everyone today. Fitzy and I will be back next week. So until then, remember, it's the little things that make a big difference, and have a blessed day.